Christian Bryant. We're happy you're here, regardless of whether you actually want to know what's going on in the world or you just need a convenient excuse to get out of something. We'll take it. Here's what we got for you in tonight's episode. Returning viewers will know this, but ITL is a show with range. We like to have fun, but we don't shy away from unpacking tougher issues, which is what we're going to do today. A highly addictive and potent form of synthetic heroin called fentanyl is driving record overdoses across the U.S.
Over the span of the last 3 years, the number of cases involving fentanyl have nearly quadrupled.
People here at the Winnebago County Health Department say fentanyl is being found in a vast majority of substances.
First responders say they believe it's a dangerous combination of fentanyl and methamphetamine that's causing this dramatic uptick in drug overdoses.
A new study found the number of illicit pills containing fentanyl seized by U.S. law enforcement jumped almost 5,000% between 2018 and 2021. Last year, fentanyl overdoses were the leading cause of death for 18 to 45-year-olds. And the way and rate in which this drug is being consumed means fentanyl users have fewer opportunities to get help. Newsy national correspondent Sam Eaton takes us to the front lines of this crisis in Seattle and looks at how changing drug use is challenging the public healthcare system's ability to keep up. We do want to warn you, this next story does have some scenes of drug use.
Walk a few blocks in downtown Seattle and the fentanyl crisis is hard to miss. Scorched foil used to smoke illicit fentanyl pills litters the streets where drug deals and drug use happen in broad daylight. Overdoses from this powerful synthetic opioid set a record here in King County in 2021, killing at least 709 people, up from 511 the year before.
Yeah, this is blue right here.
Will, who's homeless and says he's an addict, holds a strip of foil with a tiny blue fentanyl pill inside. He says these blues, as they're called on the street, are the only opioid he can get his hands on right now.
So this is more like nicotine than it is anything else, dude.
That comparison to nicotine in cigarettes isn't far off when it comes to how fentanyl is being used. The University of Washington's Caleb Banta-Green researches drug use and addiction.
I mean, imagine how a person smokes cigarettes. That same frequency, now a person's using fentanyl.
He says with heroin, someone might use 4 to 6 times a day. But with fentanyl, people are using 10 to 15 times a day.
And it also is creating, for those who like it, who it feels good to, very strong rapid tolerance and very strong rapid addiction.
An addiction that sets in a matter of weeks compared to the months or years it takes to become addicted to black tar heroin. This helps explain the rapid shift in fentanyl use and overdoses Banta-Green has documented in a newly published health survey of drug users in Washington state.
The big kind of standout number is in 2019, about 18% of people said they used fentanyl. In 2021, it was 42%. And 14% said they used fentanyl near daily. So that's just a huge transformation.
Banta-Green, who's researched drug addiction for 27 years, calls it the biggest, fastest, and most lethal shift in substance use he's ever seen. In the U.S., drug overdose deaths reached a staggering 100,000 people last year, with fentanyl accounting for 64% of those deaths. That's roughly 175 Americans dying from an overdose every single day. And according to the most recent data, many states across the country, including Washington, are seeing record surges in overdose deaths.
The challenge with fentanyl is that it might be 4 times more fatal than heroin. So that means we need a rapid expansion and really an emergency response to what we're seeing.
A response that has yet to materialize.
So this is the front line in the addiction crisis. The people being served by this mobile needle exchange represent the most in need and difficult to treat for addiction and mental health. And with only limited resources, organizations like this simply don't have the capacity to deal with this growing crisis.
The Dave Purchase Project in Tacoma, Washington runs the nation's first legally sanctioned needle exchange, started in 1988 with the AIDS epidemic. At community public health facilities like this, drug users can exchange dirty needles for clean ones and receive medical care and naloxone overdose kits. Paul Likoski is the executive director.
For a lot of the folks that come in through here, this is certainly the only engagement point they have with a public health infrastructure of any kind.
Lukoski and his team meet regularly to share updates on clients who are trying to rebuild their lives from one of addiction and homelessness.
He got a new job and has moved out of the camp that he was at.
Good.
The organization is part of what's called a low-barrier harm reduction approach to the drug crisis.
Have a good day.
It's the building of relationships with people so that when they decide they want to get help, they know where to come. And harm reduction is really rooted in absolute non-judgment of people for their behavior.
Lukoski's Tacoma Needle Exchange Initiative is also at the forefront of a more controversial service, distributing safe smoking equipment in order to reach the huge number of fentanyl users who don't use needles. The issue boiled to the surface in February when a $30 million federal harm reduction grant program to address the overdose epidemic listed safe smoking kits in the list of supplies it would fund, a move that attracted responses like this one from Republican Florida Senator Marco Rubio.
The Biden administration is going to be sending crack pipes and meth pipes targeting minority communities in this country, underserved communities. This is insanity. This isn't even about liberal and conservative anymore. This is about crazy versus normal, insane versus common sense. Where does this end?
The White House responded by saying pipes were never a part of the safe smoking kits they were funding. Caleb Bantagreen says the claim that distributing safer smoking equipment enables and even promotes drug use is an understandable first reaction. But he says it's also incorrect.
They're already doing those things, so that already exists. Right now the choice is, do we continue to let that happen in isolation, where there's a lot more disease and death, or do we actually provide safer equipment to bring people sort of out of the shadows, literally and figuratively, and start engaging with them and offer them hopefully some off-ramps from some behaviors that they would like to get under control and they don't have all the tools they need to, and we can help support them in that.
Bantagreen says his recent survey found that roughly half of fentanyl users only take the drug by smoking it, meaning a huge number of drug users at risk of a fentanyl overdose have no reason to engage with harm reduction services when the primary focus is people who inject drugs. This is why the Dave Purchase Project in Tacoma continues to distribute free glass pipes to drug users in spite of the controversy. The group brings its services directly to homeless encampments like this one, offering everything from condoms, fresh socks, and wound care to detailed instructions on how to administer a life-saving naloxone kit to reverse an overdose.
What you're going to do is if you see somebody you think they might be overdosing, that shot goes in a big muscle, so either the arm or the thigh, go right through their clothes. You just want to get the Narcan in their body as fast as possible. Anything else? All right.
Lukoski says since the Needle Exchange began distributing pipes a year ago, it's enrolled 700 new participants.
These are people's children. These are people's brothers, sisters, aunts, uncles, parents, grandparents in some cases. They're human beings and they're worthy of human dignity. And because they have because they may be in a chaotic drug use spiral doesn't mean they're any less human. It means they need more help.
As the overdose numbers continue to rise, so does the divisiveness over what constitutes help, with many considering harm reduction too permissive. But Lukoski says the hundreds of billions of dollars spent on drug enforcement, incarceration, and for-profit treatment hasn't worked. He says in 1971, when President Nixon declared the war on drugs, he was in elementary school.
Drugs aren't going to go away. Maybe we can reduce the desire to use drugs. Maybe we can reduce the harm that drug use does to society. But until we take a more thoughtful approach, we're going to get the same results.
In the meantime, illicit fentanyl is flooding the streets, taking lives at record rates. Will, the homeless man in Seattle, says he's never gone to a needle exchange or harm reduction program since he only smokes fentanyl. But every time he brings his lighter to a strip of foil, he's essentially rolling the dice in a rigged game where the odds aren't in his favor. A game that ends with so many fentanyl users like him becoming just another statistic in the overdose crisis. Sam Eaton, Newsy, Seattle.